Hi everyone, I'm Lydia, and this is a video celebrating the fact that my sex education Tumblr, fuck yeah, sex education, now has over 15,000 followers. This video will all be about the most common myths involving sex and sexuality. Hopefully it won't be as long as my other videos. I'm beginning to think it's my fate to never have a video under 20 minutes. So let's start. Our first myths are about anatomy, which are really common myths because nobody teaches us about anatomy properly. Okay, the first thing we're going to talk about is my personal pet peeve. The entirety of the genital is not called the vagina. Only the canal where penises are put in or other phallic objects are put in and you bleed out of and babies come out of, that sex canal, is called a vagina. Everything else is called a vulva. Say it with me now. Vulva. Your external genitals are called a vulva. That includes the mons pubis, or your pubic areas, the labia, those things that are all wrinkly. And it's the labia. There's the labia majora where hair is, and the labia minora at the insider ones. There's the clitoris, there's the clitoral hood, all that's called your vulva. Only the inside is called the vagina. Biggest pet peeve ever. Okay. The next one is a huge one that this myth needs to die a horrible, horrible death. That the hymen is this magical freshness seal that keeps your virginity in, and whenever it's popped by a penis, you're no longer a virgin, you're a woman. No. Horrible myth, needs to die. The hymen is this mucous membrane, which means it's really thin, it's not skin, it's really squishy and stretchy, and it's just this little crescent moon on one side of the inside of your vagina. It should not get in the way of sex. If you bleed the first time you have sex or any time you have sex, it's probably a bad thing. It means that you weren't lubricated enough, you were nervous, you didn't use enough foreplay, you had sex too quickly, you went too fast, too rough. Any of those in any part of your vagina may have, including the hymen or vaginal corona as it's more professionally known, could have torn and you may be bleeding. There are hymen abnormalities where the hymen does cover more of the vagina or becomes thicker or more brittle, but those usually need to be removed by a doctor or they make sex impossible or very, very difficult. So, virginity is a concept in your head. There are no physical differences between someone who has had sex and someone who has not had sex. A doctor can't even tell if you are having sex. That's why they ask if you're sexually active. And also sex means different things to different people. Intercourse is not the only kind of sex. There's also oral sex, anal sex. Rubbing genitals is a form of sex. Manual with your hands, that's a form of sex. So sex means different things to different people. Virginity is a made-up concept in your head. Anytime that you feel that something has changed or that this was a momentous occasion or whatever, then that's your sexual debut. Some people don't even like using the term virgin. So that's a huge myth that needs to die in a fire. Another huge myth that needs to go away, very, very far away, is that the more that you have sex, the looser your vagina becomes. No. Your vagina may get a little loose from giving birth, which is a huge baby head going through your vagina, not a penis, or any other kind of phallic object. Your vagina does not become loose the more you masturbate or the more you have sex. The vagina is made up of muscles, and if you work out at all, you know that whenever you work out those muscles and use those muscles, they don't get loose. They usually get tighter. If you have sex and you're able to control those muscles, you can work out your muscles having sex, and you are able to control them more, well, which can be really great for you and your partner. So, more sex does not equal looser vagina. That's just a way to shame people who have lots of sex. Not okay. Okay, another huge myth is that the vagina has a horrible smell and it's gross and you need to clean it as much as possible and use all these fancy products and douche. No. The vagina is supposed to smell. Every vagina smells differently. If it smells fishy or the smell changes, it could be a sign of infection. as well as discharge change, itching, or pain. If you have any of those symptoms, you need to see a doctor because it could be an infection. But otherwise, the vaginal smells are supposed to be there. If you use things like douches or any kinds of products, you're more likely to make it smell worse or to cause irritation or cause infection. Douches should not be used ever. Just don't use them. Throw them away. Feminine hygiene products should not be used either. Nothing should go near your vagina except for water. You can use a light, non-scented soap anywhere that there's hair, but actually inside your vulva, and definitely don't put anything in your vagina to clean it. It doesn't need it. But anything inside your vulva is just water. That's all you need. Make sure that there are no scented products. Do not spray perfume. Don't use scented pads. None of that. Don't do it. It will make the problem worse. So, enjoy your vaginal odor. Also, a related note, discharge is supposed to be white or clear, and it's supposed to be there. Don't get freaked out that there's liquid coming out of your vagina. That's your vagina's way of cleaning itself. If it becomes dark yellow, green, or brown anytime that you're not on your period, then you might have an infection. You need to see a doctor. It can change different consistencies. If it gets really, really clumpy and changes color, then you might have an infection as well and go see a doctor. But otherwise, it's fine. Don't get weirded out if there's liquid on your underwear. Onto penis myths. Bigger is better. No. The vagina is usually approximately around 4 inches. It can sometimes get bigger. And as you get aroused, the vagina lengthens. So if you're not aroused, it can be 2 inches to 3 inches approximately, which is why you need foreplay to be aroused for sex. If you have like an 8-inch penis and your partner has a 4-inch vagina, that can be really painful. If you also have a thicker penis, that can be really painful. Use lots of lube and lots and lots and lots of foreplay. Do it. And prepare the vagina with fingers or toys. Work up to the penis. Also, at the end of the vagina is the cervix. And a lot of people, it's really painful to have their cervix bumped. Some people it's pleasurable, which is why you need to communicate and tell your partner. But if your penis bumps the cervix over and over again, it's likely to be painful. So if you have a longer penis and all of your penis doesn't fit inside the vagina, be sure not to go all the way in. Unless your partner wants you to communicate. And also, the main pleasure point of the vagina is the G-spot, which is located only 2 inches into the vagina. So as long as you can reach that, you're good as far as size. So bigger is not necessarily better. Another huge penis myth is about the foreskin. The foreskin's gross and icky and causes infection and has dick cheese, and it makes your risks of getting HIV bigger. No. What dick cheese is smegma. This is a substance that is made up of dead skin cells and oil and liquids. And everyone gets it. People with vulvas, we get it on our clitoris, around our clitoral hood, our labia. Everyone gets it except people who have circumcised penises. It's normal. It's supposed to be there. It's not gross. The foreskin takes like 2 seconds to clean. You just pull back the foreskin and use water. Do not use soap or anything like that. One of the biggest ways that children tend to get infections is their parents think, oh my gosh, my child has a foreskin. I need to make sure to clean it really, really well. Don't do it. Parents, don't do it. Bad. The foreskin is attached to the head of the penis until they get older. This keeps it from getting infections or bacteria underneath it. If you're pulling back the foreskin and scrubbing it with soap, you're causing irritation, and usually you will get infection on your child. Like, your child will get infected. Don't do that. The only person who should be pulling back their foreskin is the child. As they get older and the foreskin detaches, then they can pull it back and they can wash with water. Just like the vagina, if you get soap in it, or around the vulva, you can get an infection or bad irritation or vaginal smells. Same with the penis and foreskin. Just wash with water for 2 seconds, that's all it takes. It has a slightly higher risk of infection, but that's probably mostly due to the fact that people don't know how to clean their foreskin because we're taught that it's dirty. See, these myths make everything worse. The HIV one, most of the places where we've done studies on, where we've introduced foreskin and done studies, they also introduce condoms and sex education at the same time. Which do you think is more likely to reduce HIV? Condoms and sex education, or cutting off a piece of the penis? Yeah, it's the sex education one. So foreskins, not bad. Stop saying they are. Okay, the next myth that we're going to talk about is myths about safer sex. Number one, sex is bad. Don't do it. You'll become pregnant and die and go to hell. I can't talk about the hell one because that's personal religion. Not everyone's Christian, not everyone believes that religion is bad. So it's kind of silly to hold up a religious belief in school. But the other ones, you're not necessarily going to get an STD or die or get pregnant from sex, especially if you're using safer sex. There's this huge myth that the more sex you have, the more likely that something horrible is going to happen to you. Not true. People who use more STIs, who use more condoms and birth control and other methods of safer sex, who have more sex, are less likely to have STIs than people who have less sex and don't use protection. A lot of people get STIs their first time ever having sex. I got it my second time. It doesn't matter how many times you have sex. If you have it when you're unprotected, you're more likely to get STIs. If you have tons of sex with tons of people and you're protected, you're less likely to get STIs. So sex is not bad. It doesn't make your vagina loose. It doesn't make you more likely to die. Nothing. It's good. It's have fun. Do whatever you want to do. Another huge one is pregnancy myths. There's millions of them. I'm not going to go over all of them. If you have any that you want addressed, comment down below. The biggest ones that I've heard of, urinating and douching after sex prevents pregnancy. Again, douching bad. It can cause infection. Also, you're more likely to push the sperm up towards the cervix, more likely to get pregnant if you use a douche. Urinating after sex is good. It keeps you from getting infections. But you're urinating out of your urethra, which is not in your vagina, which is another huge myth that I should have included. Vagina, urethra. You don't pee out of your vagina. So you're urinating out of your urethra. It's not going to push sperm out. It has nothing to do with the vagina. Okay. Also, using 2 condoms. That's a horrible idea. Don't do it. You're more likely to break the condom by using 2 condoms. Also, having sex during your period. You can get pregnant at any point in your cycle. Sperm stays inside of you for about 5 to 7 days. You're less likely to ovulate on your period, but if you're younger and you have a really irregular cycle, you might ovulate on your period or right after your period, which means you could get pregnant from period sex. So basically, if a penis comes near your vulva, you have a chance of pregnancy. If there's sperm and either semen or pre-ejaculate and it comes near your vulva, there's a chance of pregnancy. Even if you use condoms, birth control, all that, that reduces your chance of pregnancy by a lot, but there's always going to be a tiny 0.00 whatever chance of pregnancy. So don't think that you're totally safe if you just use condoms or just use birth control, or even use birth control, spermicide, the pull-out method, and condoms and all that together. There's still a chance of pregnancy. You have a really, really, really low chance. There's still a chance. Another myth is that if you get an STI, your life is ruined. You're gonna die. You're gonna never have a significant other again. I have herpes. I have genital herpes. I have a great partner. I have great sex. I have a great life. It's not going to kill me. It's not even that big of a deal. whenever they show you those huge pictures of genitals that don't even look like genitals even more, that's the worst possible case you can have. It's if you've never had any kind of treatment and you let it go for like months and months and months, and you got a really like strong strain of it, and sometimes it's even photoshopped. Usually STIs and STDs have no symptoms, which is really damaging, that they're saying, oh my gosh, if you get an STD, you're going to have horrible, horrible symptoms and you're going to die. Because a lot of people are like, oh, well, I don't see anything. I don't have any symptoms. I'm not going to get tested. I'm not going to talk to my significant others about getting tested because they don't look like they have any STDs. Wrong. You can have, most STDs are asymptomatic. They don't have any symptoms. I had like 3 little tiny bumps the first time I had an outbreak of herpes. Now I don't even have any bumps. I just get itchy. So always use protection, and you need to get tested every year that you're in a monogamous relationship and in between every new partner. You can still have sex even if you have an STD. If you have a bacterial infection like syphilis or gonorrhea or chlamydia, you can get cured with antibiotics. You don't have to deal with it anymore. If you have a parasite like crabs, you can get a treatment that kills that and you're fine. If you have a viral infection like herpes, HIV, HPV, hepatitis, you do have to deal with it for the rest of your life. You might not have any symptoms. You will probably still live unless you don't have any kind of health care, can't get any treatment if you have HIV or hepatitis. But you do have to use protection for the rest of your life because it's always going to be in your system, which you should be using protection anyway because you never know if people have STDs. So it's not that big of a deal. You just have to talk to your partner and always use protection. So STDs are fine. It's great to avoid having them because they're annoying, but you know, if you do get one, it's not the end of your life. Don't worry. I have a great life. Another huge myth is that birth control and the morning after pill are a kind of an abortion. No. Okay, an abortion is removal of a fetus or a fertilized egg or an embryo. It removes it from the body in some way, shape, or form. The pill and emergency contraception, including the morning after pill, stops ovulation. It just keeps you from releasing an egg that can be fertilized by sperm. That's all it does. If you do happen to ovulate, like if you had sex and you're ovulated while you had sex before you could take the morning after pill and your egg has been fertilized, it won't do anything. It doesn't help. It won't in any way keep the egg from implanting on your uterus. So it's nothing like an abortion whatsoever. It won't do anything. So you're fine if you take birth control in the morning after pill and you're morally opposed to abortion. And a related thing, abortion's bad. Which, again, this is a moral thing. If you personally do not ever want to have an abortion, that's fine. The main thing is people trying to outlaw abortion is horrible because you're putting so many people at risk. A lot of people medically need an abortion to stay alive, and a lot of people are traumatized by an abortion if they've been raped, if they have a phobia of being pregnant, if they are transgender and being pregnant is very dysphoric for them. There are many reasons why pregnancy would be incredibly traumatic, and you're hurting that person by forcing them to go through a pregnancy that they don't want. Also, some people can't physically be pregnant. It's incredibly dangerous to their health. They may not be able to take time off of work. Pregnancy isn't a walk in the park. You can have incredibly horrible side effects and symptoms of pregnancy, and you might not be able to take time off of work to deal with that, and you might get fired. So you're basically making a person be pregnant and spend money on a pregnancy and on a baby and possibly getting them fired. Usually what an abortion is, early abortions, it's just a clump of cells. It can't feel pain, scientifically proven. It has no heartbeat. It has no breathing. It's human cells, but so exfoliation is bad, menstruating is bad because it's, you know, an egg being released. That's a human cell, that's a potential human, an egg being released. And you see those pictures of like chopped up babies. Those are horrible. Whoever makes those pictures is a horrible person, because that's not what an abortion looks like at all. It's a little clump of cells. You can't even tell the difference between a human fetus and an elephant fetus. It's ridiculous. So basically, if you don't want to get an abortion, that's fine. Do it. Whatever. Don't keep other people from having an abortion, because it could either save their lives, save their mind, or save their jobs. And a related thing is that Planned Parenthood does nothing but abortions. Incredibly, incredibly false. I go to Planned Parenthood once a month to get birth control. If I weren't on birth control, I would probably have to have an abortion. And someday I might need an abortion because birth control isn't 100%, you know, I'm not 100% protected, and I would need an abortion. It also is the only healthcare that I can afford. I don't have insurance, so I go there for wellness exams, to get breast exams, to get pap smears, to get STI testing. That's where I got diagnosed with hepatitis, or not hepatitis, herpes. I don't even know what STI I have. With herpes, it helps so many people, especially people who can't afford a doctor. So it's the only kind of healthcare I can afford. Don't take away my Planned Parenthood, please. Another really big myth is that Gardasil causes birth defects, autism, and promotes promiscuity. No. Okay, Gardasil and other HPV vaccines are relatively new, but we've just reached the point where we have a lot of studies from side effects, and the only side effects that have been shown is the same as any vaccine, where you get a pinprick, it may hurt, your arm may go numb for a little bit, you may have some pain for a little bit, aching, that kind of thing, but you'll be fine, and it won't cause any problems. We'll learn more about the vaccines as we go on, and there's still a lot we might not know, but it's ridiculous to say don't get the Gardasil vaccine or don't get any vaccine about HPV, especially when it saves people's lives. Also, the promoting promiscuity, again, sex isn't bad, so who cares? But saying, okay, don't have sex, I'm not going to teach you how to have safer sex, that's promoting dangerous promiscuity. That's promoting people getting STIs and getting pregnant. Saying here's how you have safe sex, and just in case, you know, that person may choose to remain abstinent. They're not going to say, oh my gosh, I can have safer sex, I might not get HPV. Because Gardasil only protects from 4 different strains of HPV. They're the most common strains, but you may still get HPV. So, oh my gosh, I might not get HPV, I may not get STIs, I may not get pregnant. You're not going to go out and have a whole bunch of sex, especially not a whole bunch of unprotected sex. So that's silly. Waiting till marriage ensures you will not get any STIs. Okay, again, STIs, asymptomatic, usually don't have any symptoms. You can get different STIs from non-sexual means. You can get them from needles. You can get them through childbirth. You can get them with herpes. If somebody has a cold sore and they touch their cold sore and touch your face, you can get a cold sore, and then you perform oral sex on someone and then they get genital herpes. So there's a lot of different ways of getting STIs through non-sexual means. Also, sex means different things to different people. Again, they may say, oh yeah, I've never had sex. That usually, with people waiting until marriage, means intercourse. They may still have had anal sex, they may still have had oral sex, genital rubbing, manual sex, and all those can pass STIs. Also, even if you get tested, HPV cannot be tested for in people with penises unless they have symptoms like warts or cancer. HPV can only be tested for in people with vulvas if they have symptoms like cancer or warts, or through a pap smear. They can detect some signs of HPV. And that's it. You can get HPV from your partner even if they show no signs, even if they've been tested. So waiting till marriage does not necessarily ensure that you won't get any STDs. Biggest myth about safer sex is that abstinence education works. No. In places with larger abstinence-only education programs, like my city, usually have larger populations of teen pregnancy and larger populations of STDs, which I can attest for. We had like 20 people get pregnant by the time I got into my senior year of high school, and some had more than one child, and lots of STDs here. So abstinence-only education does not work in any way, shape, or form. We need comprehensive sex education. Okay, the last category is myths about sex. Well, number one myth is everyone orgasms from intercourse, and sex is magical, perfect fireworks, and it's effortless, and it's like a movie, and rainbows and sunshine. No. Okay. Most people with vaginas cannot orgasm from intercourse. They can only orgasm from clitoral stimulation, and the clitoris is outside of the vagina on the vulva. Some people can't orgasm or feel pleasure from clitoris and only feel pleasure from the vagina, which is where communication comes in, but most people cannot orgasm from intercourse alone. They need the clitoris stimulated by hand, by a toy, or grinding against their partner during intercourse. And it can take a lot of work. It takes a lot of communication. Awkward stuff happens during sex, trying to find the right position. You might have a muscle spasm and fall down. You might slip and fall. You might, fart, queef. There's liquids everywhere, gooey hands, and it can be awkward, but it's still amazing. You just have to work at it and communicate and try new things and talk about all the different things you want to try and what felt good, what didn't, what you don't want to do, your boundaries. It's a lot of work. So not always orgasm from intercourse, and it's not easy and effortless. A huge myth is any kind of gendered myth, like saying that women have millions of erogenous zones and men only have one, the penis, and women are more visual and they need emotional connection, and they like erotica and not porn, and men like dirty porn, and they only orgasm from direct penile stimulation, and all they need is a wet hole for their penis. Just any kind of statement where women are one way and men are another, it's false. Just automatically it's false. Everyone has different erogenous zones, and also trans people exist. Women can have penises, men can have vaginas. So it's ridiculous, and everyone has different erogenous zones. Everyone has different things that they need for sex. Don't ever assume what people need. Talk, communicate. If you get nothing from this video, get that you need to communicate to have sex. So just those are all the myths. They're pretty horrible. I hate them all. They're the bane of my existence. If you have any myths that you want confirmed or denied, comment below. If you have any questions, anything like that. Thank you all. If you're my followers, thank you for following. You're amazing. I love you. Thank you for watching this video or any video that you watch of mine. I love you. Bye-bye.